Yes. Uh, Hello, everybody. Hello, and welcome to Dr. Homer Lim from Manila. He is today in Madrid, and we have the same timing, so there is no problem for to find the good timing for a conference. Thank you for all to be with us. Thank you to Dr. Maha Shaib for this Zoom conference. And I'm very happy to share with you the knowledge of Dr. Homer Lim about senolytic, about how to still young, about how to don't make a seno cell make a normal cell as zombie cell to be in senescence. So it's a really interesting conference today to still young, maybe, or very young. So you can use this the benefits of this conference tomorrow, in 10 years, maybe in 40 years. So be really careful to all what there is sharing this night. So welcome, Dr. Homer Lim, and welcome to all our guests. And we are very happy to share with you. And I share my thanks for the high level received in Boracay in Philippines. So thank you very much, and you are welcome tonight with us.
Thank you, Dr. Ilyas. Thank you, everyone, for waiting for me. Sorry, I was a bit late. Anyway, so now we'll be talking about senolytics. So when we say senolytics, it's about treating or trying to address senescent cells. So we'll be discussing what are senescent cells. So when we say senescence, it means that the cells are actually in a what we call a sleeping mode. Okay, so this was first described by Hayflick and Moorfield in 1961. If you would remember, Hayflick's limit, wherein they were discussing. I mean, Dr. Hayflick and Moorfield was discussing that the cell seems to stop dividing after a certain number of times. So that's what we call the Hayflick limit. And they notice after they stop replicating or they stop multiplying, they go into a senescent mode, which is what we're talking about now. So it's called senescence, meaning they stop replicating and they seem to stop working. They go to a sleep mode, okay? And so therefore, because of the presence of these senescent cells, which becomes a problem, so senolytic therapy was actually proposed to address the issue of aging cells, which can affect other cells. No? So this was first proposed in 2013. So that's about 10 years ago, right? And then in 2016 is actually the major proponent is actually Dr. James Kirkland. He runs clinical trials out of Mayo Clinic on how to remove senescent cells in the body using supplements and drugs. So when we say senescence, it's when normal cells they don't die and they enter a state of what we call senescence, or actually they go into a state of asleep. They're asleep. They're not doing anything. They're taking energy. They're taking food. But sadly, they become a problem later on. However, if you notice, as you even in newborns, you already have 5% of senescent cells. However, as you age, it increases, and in some people it can go as high as 30 to 40%, which becomes a big problem. Because why do they matter? Because if you have more senescent cells, they become an issue because they can actually cause what we call accelerated aging, meaning age faster than normal. The more senescent cells you have, the more you develop what we call age-related illnesses, which one of them most common really is atherosclerosis, osteoarthritis, of course, diabetes, Alzheimer's, and pulmonary fibrosis. So senescent cells really matters a lot because the more you have, the faster you age. So very, very important to know that. And senescent cells actually become larger in size, and they become more irregular. Okay. And we then discuss now what actually promotes senescent cells. Okay. And you see one of the biggest contributors of senescent cells is overnutrition. So if you eat too much food, actually, it can actually trigger your cells to become senescent. Okay, so number one, of course, is aging, as we discussed earlier. Once cells have the what we call the Hayflick limit, which is the number of mitosis. Once they reach that limit, they stop multiplying or mitosis, and they enter into a period into a mode what we call senescence. So what other factors actually increases senescence, which is very, very important? Again, overnutrition or obesity, pollution, chemicals, as well as chronic inflammation. So if you have, it's a deadly cycle. If you have diabetes, then you're overinflamed, and that actually increases senescence. Similarly, if you have a lot of senescent cells, it can actually accelerate aging, as well as I mean, it aggravates your diabetes. So it's a deadly cycle. It's very important to remember that if you're obese, you're more likely to have more senescent cells because these, especially senescent cells, are actually in your fat cells or adipose cells, and they concentrate more over in your subcutaneous tissue. Okay, so the more fats in your subcutaneous tissue, the more likely you will have what we call senescent cells, which is so we really have to make sure that we don't have too much adipose tissue or fats in your subcutaneous, because really that contributes a lot to senescent. So, but why do we have senescent cells anyway? The primary reason we have senescent cells is it acts as a protective mechanism to avoid or prevent cells to become cancerous. Okay. Number two, if you would, why would when you have a wound, why would wounds not form too much scar, right? So one of the things there that really affects wound healing is senescent cells, right? Why would some people have what we call keloid formation or scarring? Maybe because the senescent cells are not enough, which actually promotes keloid formation. And if you would think about it, when babies or embryos or in the womb, how do organs form without without over manufacturing or over multiplying cells? How come they stop at a certain uh, volume? That could be exactly because of the presence of senescent cells, which controls the growth of organs in the body. And of course, regeneration or modeling, as I said earlier, if you're stressed, if your cells are damaged, how do we avoid that from in being overinflamed? So that's where your senescent cells, uh, and these senescent cells actually produce what we call senescent associated secretory uh, factors, or what we call cytokines. And these senescent cells actually have a category. It's called senescent associated secretory phenotype, or SASP. So they actually help in the generation and remodeling of cells during injury and repair. At the same time, it also helps in modulating your immune system without overly affecting normal cells, but actually helps out clear out old and damaged cells. It also helps in fibrosis, as I mentioned earlier, and senescent cells also very, very important in the formation of your mammary glands. However, as I said earlier, what's the consequence of too much senescent cells? You will have definitely DNA damage later on, mitochondrial dysfunction or inactivation, and chronic inflammation. So, and what's worse is senescent cells actually can actually affect your stem cells. So once you have too much senescent cells, which produces what we call the inflammatory cytokines, they can actually put your own healthy stem cells into a senescent state. So it's really bad if you have too much senescent cells because even your own stem cells will go into a senescent state, which actually makes it even worse. Okay, so this is just a video of exactly how senescent cells would uh, would actually affect normal cells. So that's why we call them zombie cells, because once they are in contact with other cells, they actually influence the other cells to become senescent themselves. So that's why we call the senescent cells zombie cells, because they turn the other cells into what we call senescent cells. So what's the consequence of senescent cells in organs, tissue? You will have organ you will have some wrinkles, which is signs of aging, but it's really because of the amount of senescent cells in the skin, in the fat tissue. As I said earlier, the more senescent cells, the more inflamed your body would become. In the liver, you can develop fatty liver, or even worse, cirrhosis, and in the lungs, pulmonary fibrosis. In the kidneys, you have chronic renal insufficiency, and you could see in the muscles, it can actually decrease uh, or actually help or make your muscles weak, no? So it's really very important to understand the senescence. So in the blood vessels, it makes your blood vessels becomes more hard, or what we call atherosclerosis. And of course, in the joints, it will later on lead to degeneration in the form of osteoarthritis and osteoporosis. Okay. And senescent cells can significantly decrease your immune system. So it's very important really to be aware of this. And in the brain, it can lead to neurodegenerative conditions such as Alzheimer, Parkinson, dementia, as well as, of course, in the heart, it can later on lead to decreased cardiac function, or what we call cardiac uh, myopathy. No, so how do they how do they identify senescent cells? The most common and often used marker is what we call the SA beta glucosidase activity. That's how it's a marker of senescence. So the more SA beta galactosidase activity, the more then we know that that cell is actually in a senescent state. Okay. So again, if you have senescent cells, they produce a lot of cytokines in the form of IL-6, interleukin 6, interleukin 1 beta, and tumor necrosis alpha. And if you are aware, if you remember, these specific cytokines are actually very pro-inflammatory. They can actually drive your cells, your organs, your body into an inflammatory state, and can lead to degenerative conditions, or even worse, cancer. Okay. And you can also identify senescent cells through their DNA by marking increased levels of the gamma H2AX, which is a sign again of DNA damage, which also identifies the cells to be in a senescent state. So it's really also important to, so how can we reduce these increase number of senescent cells in the body. So that's why there was a proposal of trying to decrease the number of senescent cells because it leads to accelerated aging and disease. So in your body, it's actually your macrophages and natural killer cells that actually cleans up and removes senescent cells. Sadly, as we age, the number of macrophages and natural killer cells also decline. So our ability to actually clean and remove senescent cells are also decrease because of, again, aging. So as you age, your senescent cells increase. What's very important is the number, the rate of increase in senescent cells. If you are obese, you're diabetic, you have heart disease, kidney disease, guess what? The rate of increase of senescent cells also increases. So it's really very important to decrease the number or the rate of increase in senescent cells. So this is just a graph showing you that this was a paper published wherein when they introduced serum or the serum of young mice to cells versus the serum of old mice, they found out that those who are exposed to old mice serum, the rate of senescence becomes higher. So you could actually see in old patients, the number of senescent cells increase rapidly versus those of the young blood, uh, simply because they have so much more inflammatory cytokines which are actually produced by your senescent cells. So why is this important? This is important if you have patients who are looking into what we call stem cell therapy, wherein if they want to get stem cells from their own fat tissue. However, if they're already obese, they're old, the number of the number of stem cells that they will be able to harvest will be significantly less as compared to young people who have adipose-derived stem cells. They're still very, very active. Okay, so that's really one of the reasons why getting adipose-derived stem cells, especially in sick patients, is not a good idea. Okay, again, this is just a paper showing you that in patients with obesity, right, their number of adipose-derived stem cells are actually in a state of senescence. So, that's what I'm showing you. It's just to tell you again that it's not a good idea to harvest adipose-derived stem cells from obese patients because it actually drives them into more senescent cells. So it's very important to remember that. And they showed you if they actually transplanted organs from old people into young people, it can actually increase the rate of senescence. So it's really very important, especially in organ donation. We hope we optimally we want to get organs from younger donors, because if you get organs of older donors, it drives the young recipients to have a accelerated senescent cells. And again, obesity drives not just anxiety, it's just because of the amount of senescent cells. So you could see here this paper showing you that in mice who were obese, they had higher anxiety levels simply because one of the reasons because they have too much inflammatory cytokines, which is your interleukin 1, interleukin 6 as a tumor necrosis factor, and that actually increases anxiety. Okay. So very important is the timely clearance of senescent cells. We have to make sure that we are able to clear them at the right time. Okay, we don't want to clear senescent cells early in life because you still need senescent cells. However, as you age, there's definitely a need to address this and reduce the number of senescent cells. So, what can we do to reduce senescent cells? That's where senolytics, or what we call senolytic therapy, which is a class of drugs that actually tries to remove or eliminate senescent cells. So again, there are categories. You have the BCL2, tyrosine kinase inhibitors, flavonoids, HSP90, which is your heat shock protein 90 inhibitors. But most of the clinical trials now are concentrated on the BCL, tyrosine kinase, and the flavonoids, okay, which is what we're going to discuss. So the major targets in senolytic therapy are the SRC. You could see there SRC, or the PI3K and BCL2, as well as HSP 90. No, you could see there the what type of drugs for each of the categories, and most of the flavonoids activity are on the backs, or BAK back, and PI3K. Senolytic therapy is really very, very new. But one of the things also, aside from senolytics, is xenomorphics, which is how to reduce the release of inflammatory cytokines. So there are also drugs that can help in decreasing the release of what we call inflammatory cytokines by the senescent cells. And the most famous actually is rapamycin. Metformin is actually an mTOR inhibitor also. We also have the JAK inhibitors, as well as statins, and of course, glucocorticoids, or your steroids, which also helps in decreasing the amount of cytokines released by your senescent cells. Okay, so when we categorize senolytic therapies, you have natural compound, of which actually quercetin is the most studied, but we do know that curcumin, resveratrol, as well as fisetin do have a strong senolytic activity. Then you have what we call the dasatinib. Dasatinib actually is used as an immunotherapy drug. And also, of course, again, the BCL inhibitor, which is again, it's an immunotherapy drug, navitoclax, which is again, this is used also for cancer. Okay, so you have also peptides, which is not really being studied so far. It's still in the preclinical state. But really, the most common is using the dasatinib, as well as the flavonoids. Okay, so there are now studies being done in Harvard, as I said earlier, by Dr. James Kirkland, how to treat senolytic senescent cells, especially in uh, organ donated organs, right? Because some of they found out that if you treat organs, try to remove as much senescent cells, you have a much better um, success in when you transplant these organs into donors. Okay, I mean into recipients. So it's because if you have too much senescent cells in those organs, then the lifespan of the recipient becomes lesser. So one way to improve or maximize the organ transplantation is really to remove the senescent cells in these organs. Okay, now they did a study using dasatinib and quercetin, but and they found out that dasatinib quercetin is really very good in eliminating senescent cells, but very important, it does not affect your healthy cells. Okay, and it really helps in improving your heart, improving your glucose, and even decrease your cancer incidence and slows your tumor progression. Okay, so again, as I said earlier, one way to identify the amount of senescent cells is using the marker SA beta glucosidase, and they found out, as I said earlier, subcutaneous fat has higher amounts of senescent cells compared to the visceral adipose tissue, and senolytic therapy can actually help reduce the number of senescent cells. So there is a clinical trial wherein they tried senolytic therapy using the dasatinib quercetin in idiopathic fibrosis. If you would note that if you would see, they only give 3 days of the dasatinib 100 milligrams per day, quercetin of 1,250 milligrams a day for 3 days a week for 3 weeks. Okay, they don't want to give too many or too long periods of dasatinib and quercetin because it actually can cause problems. But if you give it a short pulses, right, it it really seems to have a significant effect on their endurance. So you can see there in patients with idiopathic fibrosis, their fatigue becomes less, and they're able to actually become more motor independent. Okay. Again, they also did a progression. I mean, they also did a senolytic therapy for Alzheimer's disease. What they want to find out was, can the dasatinib actually penetrate the blood-brain barrier, and this actually showed that the dasatinib and quercetin can actually penetrate the blood-brain barrier. This is still phase one. They're doing now phase two to see if it actually helps the cognitive function later on, which is actually because cognitive function takes time. So one of the more popular senolytics actually what they call fisetin. Fisetin, you get this from actually fruits. Fruits high in fisetin are actually melon, uh, pomegranate. They have high amounts of fisetin. And similar to dasatinib and quercetin, they eliminate the senescent cells, uh, decrease the number of inflammatory cytokines, and they found that fisetin can actually help again improve your heart, your sugar, reduce cancer incidence, and improve your cognitive function. So they did a clinical trial of fisetin in elderly, or what we call old people, and they checked for their inflammation as well as markers of inflammation, as well as bone resorption, or do they have a higher or lesser amount of osteoporosis. Okay, so they gave fisetin at 20 milligrams per kilogram. If you could see, they're only 2 days, so they only gave fisetin for 2 days. What they found out was it actually decreased the blood inflammation markers. And when they actually added dasatinib, quercetin, and fisetin in older adults, they found out that this therapy actually helps in building bones. So it actually helps to improve or reverse osteoporosis in elderly patients. So senolytic therapy again, without using, the drugs, which is the dasatinib, you can still use your quercetin, your fisetin, your resveratrol, as well as your apigenin, which you get from grapes. So these are the other senolytics that are being used aside from what I mentioned earlier. So even your green tea or EGCG or green tea is actually very, very powerful senolytic. So takeaways for this particular topic. Everyone has senescent cells. Okay. But however, if you're obese, you're highly stressed, and you have a poor diet, it will drive more senescent cells. And these senescent cells can significantly impact your own body, including organs for transplantation. As I said earlier, if you would transplant old organs to younger recipients, it actually drives more senescence in these young recipients. So it's very important to remove as much senescent cells in organ transplantation. And use of senolytics is not only just to improve lifespan, that actually improve cell therapies or organ therapies, not just cell therapies, okay? And it actually helps in treating your degenerative diseases. It also may help improve your heart, your cognitive function. However, senolytic therapy is still its early stages, but it is really promising because you don't even have to give it on a prolonged basis. You only need to give it maybe 2 days or 3 days a week. That also already had a significant impact on decreasing the number of senescent cells in your body, specifically in your subcutaneous tissue. Okay? So thank you everyone for listening to this topic. Back to you.
Um, Thank you very much. Hello.
Yeah.
Uh,
Yes.
Thank you very much for this conference. Maybe if there is some question, we can share the knowledge with Dr. Omar Lim. So we will take some question before close the Zoom conference. So if there is any question, please, the microphone is open. So welcome for all of you.
Thank you very much indeed. I'd like to ask a question. Dr. Maha, Dr. Baghli.
Yes, Dr. Amina, how are you? Yes, you have a
Fine,
question.
thanks. We'd like to be. Yes, I've got a question. Well, Dr. Olmer says that all the organ donors will drive the young receivers to have more senescent cells.
Yes.
It means that the donor, yes, this is what you've said. This
Yes.
is what I have understood.
Yes.
I mean,
correct.
it means that someone who is healthy and he's old, it means he's got more senescent cells. So he will probably, if he gives an organ to a young person, that person will receive also senescent cells of the older organ.
Yes.
And this is really astonishing. Maybe a healthy one and a person is deceased may become deceased because, or at least he will have senescent cells that will make him older
Yes.
instead of being.
Correct. Correct.
That's my first question.
Yes.
Another, you have also said that the drugs you have mentioned decrease inflammation as they are as inhibitors. But how you have used one natural one is that the curcumin that we do not use very much in our. How could you please be more explicit on the two questions? Thank you for this great conference.
Yeah, well, I personally wouldn't use dasatinib because it's still it's a chemical. It's not natural. So we avoid that because we don't really know what would be the long-term effect of dasatinib, but we do know if you take lots of, curcumin or turmeric, the quercetin from onions and garlic, fisetin. These are all natural products, and we've been taking them for thousands of years. We know its safety profile. So really very, very important, or I mean, it's really great that we have this option of using these types of herbs, right? Or what we call phytonutrients that actually can help reduce the number of senescent cells in our body without harm. Uh, I remember dasatinib is an immunotherapy drug. They use this for multiple myeloma. Uh, just to give you an idea, if you're doing chemotherapy, so when they do studies on senescent cells, how do they increase the number of senescent cells in mice or rabbits or whatever animal? They would give a chemotherapy drug. So chemotherapy drug itself drives senescence. That's why you see in patients doing chemotherapy, suddenly they look like 30 years old, because these
Yes.
chemotherapy drugs actually drives your senescent cells. So one way to decrease that is actually to use what we call senolytic therapy. So very, very important to understand and realize that chemotherapy drugs, or drugs in general, some of the drugs in general, can drive senescence. So it's very important to remember that. But one way, of course, if they don't want to, I mean, if they want to add drugs, so what drugs would help remove or at least decrease the amount of senescence is actually rapamycin, which is not widely available. But the next best thing is actually metformin. If you actually go and Google, metformin has been shown to actually not decrease, but actually reverse aging in a monkey. So that really shows you that metformin drives or removes senescent cells and even reverse aging. So it's very important to take note.
So for
Thank you very
that,
much indeed.
metformin is using now as chemotherapy without senescence side effect.
Yes, correct. That's another topic.
Yes.
That's
That's
another
another.
topic.
So in association with chemotherapy, this is the idea.
Mhm. This is what I have understood.
Yes.
Okay.
That's interesting to know about that.
Yes.
Really,
Yes.
it's another question, if you do not mind. Something you've said that every one of us has senescent cells. Every
Yes.
one of us have. So we, the best way is to reduce these senescent cells by leaving stress, poor diet, and obesity. This is what you said. So we need to go to orthomolecular medicine of Dr. Barli to be able to remove those senescent cells, or to reduce them at least, and to stay young.
Yeah.
It's your
Correct.
idea.
Yes, correct.
Okay. Thank you very much indeed for this great conference,
Thank
Doctor.
you.
Thank
you-
you
Thank
so
you,
much.
And you can look the effect of senolytic on Dr. Omar Lim. He was doctor for 35 years, and he looked like 35 years.
Uh-huh. Yes, he looks so
Yeah,
young,
jokes.
mashallah. And so
Is
do
there
you.
any other questions? I can see on the chats. No other questions?
So
You have a
Yes.
third question, Amina?
Yes, I've got another question, but I don't want to take all your time. But I've got lots of questions. That's why I didn't really want to overcome the situation. You've used, technical words that I'm not used to. Those senolytics, according to you, senolytics therapy goes by those quercetin to module, for example, you have used adenine B and quercetin to module Alzheimer disease. How? How come? And fisetin for bone resorption. Are these drugs available, or are they only, used in your literature? You have not used, only on mice. How about human beings?
Well,
How can
they are already on clinical trials wherein they use uh
mhm.
okay, you have to understand, drug companies will not fund clinical trials using these types of therapies, right? It has to be somebody has to do it, which is probably some what we call institution that would have enough money to fund this, but the clinical trials right now on senolytics, they're really concentrated on the uh, drugs, which is the most famous is actually the dasatinib. But the studies that I showed you earlier on fisetin, these are clinical trials. You could see there that the reference there that
Yes.
it can improve cardiovascular function and reduce hypertension, improve your glucose function, as well as cognitive function. So it's really there's really a clinical papers or studies showing the effect of not just fisetin, it's quercetin, your curcumin, in fighting off or increasing the number of senescent cells.
Okay. The very last question: how about emotions and senescent cells?
Well,
Do let's say
yeah, agree. I mean,
negative thinking impact?
yeah. So when we say stress, it's not only emotional, physical stress. It could
Yeah,
be physical, emotional, psychological. So
emotional,
any types of
psychological.
stress, yeah, any types of
Yes.
stress would actually drive inflammation, and that inflammation can drive more senescent cells. Okay,
Ah,
so very
the
important
birth,
to
the birth of senescent cells.
yeah,
You mean all the
yeah,
birth of new senescent cells?
it will increase the number of senescent cells.
Okay. Okay. Thank you very much. Thank you for this information.
I hope
Thank
to
you,
thank
Dr. Maha. Thank you,
Dr.
Dr.
Homer
Bali.
Lim also for his working with us for the study about hybrid orthomolecular protocol for cancer. So he starts to do a study with a patient with cancer. So we are very glad about his working twice with us. So thank you, Dr. Homer Lim, for what you do in Philippines, in Southeast Asia, and also for the study for treatment of cancer. You can share a little bit about what you are doing now?
Well, for cancer, no, what we call the repurposed drugs in cancer, no. So we are
Yes,
using metformin,
yes,
ivermectin, mebendazole, or fenbendazole together
yes.
with statin, which is either your atorvastatin or simvastatin, and aspirin in fighting off or trying to combat cancer, no, especially in patients who have already failed chemotherapy, radiotherapy. We do note that even in those who have resistance already to conventional cancer therapies, these drug protocols, cancer what we call repurposed cancer drugs protocols, are actually
And
uh
and of course, vitamin C, vitamin D, and zinc.
vitamin C, vitamin D, selenium, zinc.
Zinc,
Uh,
of course, magnesium. Yeah. So we will see the results of your study with the study of Riordan Clinic. We will start tomorrow. We have a Zoom conference with them, and all the best for all the patients in the world. So thank you for making happen. Thank you.
thank you, thank you.
Okay. The last word for Dr. Maha Shaib, and we close this Zoom
Okay,
conference.
thank you so much. Thank you everybody for assisting this conference. Thank you, Dr. Homerlim, for this brilliant presentation.